could do a discount code for extra tough.
Yeah.
Okay, starting again.
Notice extra tough. I wear these all the time. They're so comfortable.
Your preferred brand for doing yard work.
I love them. And I discovered them in Alaska. And now Megan and I both have extra tough.
Yeah.
They're so comfortable. And they're great for yard work because you don't get your shoes soaked.
Mm-hmm.
All the grass stuff just washes off.
And I'm hoping it'll translate into the hospital so I don't get bodily fluids and blood all over me.
Actually, it may be very good for the trauma bay and
Mm-hmm.
OB. All right, so we're back.
We're back. So it's been about a year since we chatted on this couch about med school stuff. And about this time last year, I was going into 4th year, right? Yeah. And now I'm done with medical school, graduated, did the whole 4th year process of creating a rotation schedule, going through interviews, going through the match process, and now I'm out on the other side of all of that.
You're a doctor.
And I'm a doctor.
Medical doctor.
Which I think it amuses me to think that I'm theoretically a doctor, but I feel like that not quite in practice am I a doctor, but soon, very soon.
Well, you've been introduced as a doctor in a clinic.
Yes.
Yesterday.
I was introduced with the doctor title, and it was surreal, but exciting.
Yeah.
And I think it'll be very real on July 1st when I start in the emergency room, which I'm going to need lots of tips for that.
Oh, we're supposed to do some suturing lessons.
Mm-hmm.
Okay.
Yeah.
Anyway, we'll do that.
And yeah, I think it'll be a lot more real on July 1st, the being called doctor and feeling like that is now my new role.
Yeah.
But yeah, so I think today we were going to go over picking up where we left off for the next year in med school. I think we talked about the process to get into med school and things to consider when applying. And then now, having gone through med school, talking about 4th year in that process.
Yeah, so so the last time you were starting your 4th year, now we're going to go through how you chose your 4th year rotations. And so what was our format?
So picking 4th year rotations and that schedule.
Yeah.
And then the interview process and recommendations for that. The match, post-match.
Yeah. And then now, like, when does med school kind of end, and that little gap of time you got to prepare for your internship?
So I guess we'll start with picking 4th year rotations. Yeah. So by the time I got to 4th year and it was time to start picking those rotations, I knew I wanted to do anesthesia. And that's not always the case for a lot of my classmates. Didn't quite know. They had narrowed it down to a few or narrowed it down to 2. And so the priority in those first few months of 4th year is to pick the rotations in the career or specialty you're most interested in. So I made sure that, and also for thinking to application for ERAS, which is applying for residency programs, thinking about those rotations that are going to make it onto your transcript for that interview season, for the application season. So I think it was the first 5 or 6 rotations of 4th year for our institution, how the academic years are set up, make it onto the transcript so that schools can see, residency programs can see what I've taken so far in 4th year. So that's also something I kept in mind, is what rotations are going to help me explore the specialty that I want, and then which ones do I want to show my strengths as I go into interview season, because those will be the ones on the transcript and discussed during interview season. So I picked anesthesia rotations first, and other rotations that I thought would be important to show strength in. So I picked NICU, medical ICU, anesthesia, And I did a second anesthesia rotation at another institution within my school in a different city in a different hospital. So I did 2 anesthesia rotations.
Wait, so explain that one.
Yeah, so there are away rotations that people can do, but mine wasn't technically an away. It was away from my home institution,
Right.
but it was still under my home umbrella.
Okay, so easy to set up.
Yeah, it was easy to set up. So I didn't have to do the away application process, which is a whole nother topic. And I just was able to schedule that rotation, and then I went to another city, a different hospital, and did anesthesia there for a month. So I had 2 of those on my application. I had a medical ICU. I had perioperative medicine clinic, which I thought was really important because it was pre-op optimization for patients, and anesthesia was involved in that, in creating anesthetic plans, and were a part of that clinic environment, which I thought was important. So those were some of the ones that I thought would be really helpful in creating my application to residency. Having exposure to anesthesia, being able to talk about that during interviews and draw stories from it to try to solidify my reasons for going into anesthesia and having something to talk about, and then demonstrating other strengths, like in the MICU. I thought additionally that it would be helpful to interface with faculty that might be able to write a letter of recommendation, because that's kind of the time, hopefully, as like in our last video, we talked about having those longitudinal relationships with faculty, with professors that might be able to write a really strong recommendation because they've had this long time to see you grow in your academics and your professional identity. So it's really nice to have someone speak to that when you're applying, whether it's applying to medical school or now applying to residency. And so that was part of it, was scheduling rotations where I could have one-on-one FaceTime with faculty that might be able to write me a strong letter of recommendation. So that's kind of how I scheduled out the first half of 4th year, the half that's going to make it onto my ERAS transcripts, be included in the comments, and be able to have faculty write strong letters of recommendation. And one of the things that I did was I chose rotations, maybe 1 or 2, that during that first half of 4th year that had faculty on it that I had worked with during my 3rd year. Because I knew that they saw me when I was just beginning clinical years, and then I'd be working with them for a month during 4th year. So I've had a year of growth, and they're about to see me at that time where I've had a year to learn. And then they might be able to write a strong letter of rec looking at my growth over that time. So that was successful for me. That strategy was helpful because I did schedule a rotation with an attending who was with me day 1 of 3rd year and was able to see how much I had grown and was able to write a strong letter based on that, which is really helpful. Right. So. Yeah,
I think that was your technique on that was spot on.
Okay, so that was picking 4th year rotations, and then really everything after that, after the ERAS cutoff in the fall, I just picked fun things that met my school's requirements, but were things that were enjoyable. I had some pediatrics and just EMS, just fun things that I got to explore that I might not be able to do in the future, or just things that sounded interesting. So have fun with the latter half of your 4th year, picking those rotations. So then the interview process.
It was different, much different than ours were essentially obligatory in person. Like if you really wanted to go somewhere, you had to go in person. And now that's not the case.
No, it's not. For most specialties, the interviews are virtual. And I think that started in 2020. So pretty new. And it seems like most specialties are sticking to that virtual interview experience. So there's several different platforms that programs use. I use several different ones. And I do know a few classmates who went into other specialties like vascular surgery was in person for some.
Okay.
So some specialties are doing in person, but the virtual format is pretty common now. And I'm curious if that's going to be the new trend for interviews. But, I enjoyed
What did you
it.
think about that?
Yeah.
Did you know it was going to be virtual? I guess you did
I
from
did,
all
yeah.
the friends of yours that were a year ahead.
Yeah, I knew it was going to be virtual, and I enjoyed it. I appreciated not having to jump on a plane and go somewhere and get housing and do all that. But then there's also, it's hard to get a feel for the program, but I think programs try to make up for that by doing these second looks. So it was before, or I'm trying to think, it was after rank lists were made, I think, for a lot of mine that I saw. It was like the January timeframe, January, February, where these second looks happened. And so they should have no bearing on the rank at all. So it just is informational for you to go get a tour of the program and have dinner with residents and do all the in-person things without the scrutiny of the interview. So
okay, so match day is March 15th. Back it up. And so when did the interview season start?
So interview season started for anesthesia October, like mid-October is when we started getting a lot of the interview invites and those interviews starting to be scheduled. I think October timeframe was the earliest.
And how many programs did your school recommend that you interview for or send interest messages to?
So
and then how do you send the interest? Like, how did you get on their list to say, hey, you're interested in us, we're interested in you?
For my program?
So for, you want to do anesthesia, how do you set up, like let them know that you want to interview and then they let you know, hey, we want to interview you?
So I got plugged in with the anesthesia residency program director at my institution probably around during the end of third year and when I had my anesthesia rotation, lots of interfacing with the residency program team, the coordinator, the PD, the APD, and so they knew my interest, and then they were able to mentor me about how many I should apply to, and they took into consideration my geographic preference, and so with that being said, I ended up applying to 32 programs, but initially I was only applying to about 15 to 20. And so they definitely recommended casting a wider net. And so
that just seems like a lot.
Yeah. And 32 was on the lower end of some people that I heard, they had 60 programs that they applied to, but they also had maybe a bigger geographic preference. Whereas I really wanted to stay in the Southeast. So 32, I think I went out to Kentucky and Texas, and as far north as West Virginia, I believe, and then as west as Texas, and that ended up being my catchment area, I guess. But so I definitely was on the low end initially, and it was advised to almost double the programs that I was applying to.
Yeah. So essentially impossible if you're doing in person.
Yes.
But totally possible if you're doing virtual.
Yeah, absolutely. So there were, a lot more people applying to different programs.
But so this is for my sake, what's the mechanism? Okay, I want to apply to anesthesia UAB, and I'm at a different school. How do you send that message to UAB to where? Yeah.
Yes. So I think they started it last year. I'm not exactly sure, but it's new. It's something called signaling.
Okay, signaling.
And so they're still getting data on that, all the things, all the metrics they want to figure out with the signaling. So for anesthesia, I believe there was 5 gold and 10 silver. And so, for example, if I wanted to show UAB that, I'm some random no name from a different institution, I didn't do an away there, because that's another method of telling a program you really like them is being like, hey, I'm going to spend a month during fourth year training at your institution, which is like a month-long interview. I didn't do that. And so one of the ways I let them know they were on my radar was sending a gold signal.
Okay.
And so then that kind of lets the institution know, hey, I am really interested in you. And it kind of helps, it can help filter applicants. Maybe whether or not you get an interview. Although I did get interviews at places that I did not signal, neither gold nor silver.
Really?
Yeah. So
Okay.
it's still, they're still trying to figure out how helpful are the signals in getting interviews. But it did seem like the verdict was for this season that signaling for anesthesia, that signaling mattered.
Okay.
So.
And so you're limited to how many golds, which golds is the one like your top tier that you want.
Right.
And then do you just get an email through that program from them saying, hey, let's set up an interview? Or do you how do you pick your dates and all that?
There are platforms. So there is the big ERAS standardized application set, and then you get notifications through that you have been selected for an interview, and then you schedule that interview directly through whatever platform the program has decided they're going to use for virtual interviews.
Okay.
So there's different platforms for that. And so I would get an email through the AAMC ERAS portal that I've been selected for an interview.
Okay.
And then go from there in terms of selecting dates.
And then was it a pretty easy process to select your dates?
I thought so.
Your school said, hey, like if you were on a rotation and you told them, I've got a virtual interview on this day.
Yes.
And they're cool with that?
So cool with that. Yeah, our school was very, very flexible. There's one time where I had maybe 5 interviews during one month rotation, and they were totally fine with me taking half days to do that.
And because one thing I just remember, and correct me if I'm wrong, a lot of times you would have your interview, but then you'd get to talk to some of the residents before, and then do like a kind of an after party.
Yeah,
that was cool. Tell me about that.
They did virtual those in virtual format. So the night before the interview, what was pretty standard is the night before in the evening, there would be a resident meet and greet. And so it would just be the residents and the applicants that were interviewing for that next day. And so it would just be a tiny platform. And it could have been on Zoom. It could have been on Thalamus was one of those. And so one of those platforms, the video platforms. And there would be a resident meet and greet where you can ask all kinds of questions, just the residents, no faculty. And then sometimes there would be faculty on there, and then they'd pop off the call. They would give like a little bit of information, they'd leave, and then it would just be open to the residents.
Then you could do the real talk afterwards.
Right. So that was pretty typical to have the evening before the interview be the resident meet and greet, which took place of the in-person resident dinner, I guess, that people usually had, or mixer. But yeah.
Okay, and then tell me just funny story. I remember a couple of things, like you get kind of an idea of the personality of the residents. And was there any story that kind of was funny or sticks in your head? Hey, I would love to go to that program because of what this resident said, or maybe I'm a little bit wary of this program because of what this resident said. So does anything stick out in your mind from that?
Immediately, a story comes to mind. So there was one program I interviewed at, and the resident said that they had a snack crew, and they petitioned their faculty to give them a monthly, I think it was $500 a month or something like that, for snacks, a snack stipend. And so then there was like a designated resident snack crew that would go to Costco, load up on bulk snacks, and they, they got faculty to buy into that and to buy them snacks in bulk. And I thought that that snack crew was just a great idea. I thought that was so fun.
It's the simple things in residency that make it tolerable.
Yeah.
And definitely snacks are way up there.
Mm-hmm. Yeah, I loved it when the residents talked about all the perks and things to do, like, where the nice call rooms are, where all the residents hang out, where's the good food, the good coffee, all of that camaraderie stuff, and the, increased quality of life, of the work life. Those were the ones that I had the best time interviewing with. And yeah, and some of the ones that made me a little bit wary, I guess, were stories about, when one resident would talk about how another resident took a medical leave or family leave and how that put a massive burden on the class.
Yeah.
Those ones made me a little bit wary.
Yeah.
Because it was just one person that went out that caused a massive strain, and it seemed like it was an annoyance and a burden to everyone to have that person gone. And life happens during residency, and so it made me wary when that became a really...
Well, yeah, you get a parent sick, or
right.
like I had appendicitis my intern year. You remember?
I remember that.
Yeah. And my senior resident, I remember, was so irritated.
Wow.
That I ended up coming back after 2 days.
Wow.
So I had my outpatient surgery. I was home for 2 days. So on the third day, I rounded and vomited in the trash can because I ended up developing an abscess.
Oh my gosh.
So then I was out another 10 days, whereas if he would have just let me, if he would have just said, dude, take care of yourself, then I probably wouldn't have gotten an abscess from being up and walking around too quickly.
I didn't know that part.
Yeah, I got an abscess, post-op abscess, and probably got up too soon. I ended up getting a cutaneous abscess, probably, had a serous, a little bit of serous fluid collection that ended up getting infected. And then I was even sicker. I was febrile, a little bacteremic.
Oh, my word.
Yeah. And so they had to drain the abscess, and I had a wick, and so then he lost me for essentially 2 weeks.
Yeah.
Instead of just letting me rehab, But
yeah. And those kinds of stories would, during the interview process, if there was something like that, it would make me a little wary.
Yeah. And then with those after parties, I call it after party, but when you just get the residents on there, you can kind of see the personality of the residency, even though it's virtual.
Yeah. Yeah. I felt like I got to get a good flavor of how residents interacted with each other, because a lot of them would, they'd kind of bounce ideas off of each other and go off of what the other person just said. And so you can see if the dynamic was smooth and not awkward. You could see if they were cohesive, if they had good laughs, and, if they had a light sense of humor. You can kind of pick that up on the hour Zoom meet and greet.
Yeah, your residency classmates make or break your residency experience. And my first residency had unbelievable camaraderie. And then my second one with ER is different just because you're always on different shifts. So it's, there might be 3 of you, a senior, a second year, and a first year. But then the rest of your classmates are completely not with you. So it was kind of a different experience, my second residency. Great residents, but we didn't get to spend time in the hospital together,
Which is where you build those late night
bonding.
That's
all those stories.
So I guess we did the picking 4th year rotations. We did the interview process. I'm trying to think if there's anything else to discuss about that.
You had some staff that were very interested in you and kind of, I think you had 2 other programs that you were super interested in. Logistics was the thing for you because your husband he's a lawyer, so he's passed his bar in one state, so it makes it just more difficult, for you logistically.
And so one of the things that I found on the interview trail was some discussion of anesthesia, but really a lot of discussion of extracurriculars. Lots of things that I did before medical school. talking a lot about that and experiences and stories, and it was really helpful to be able to draw from those experiences and talk about them, and that was really the bulk of my interviews.
What were they interested in, like extracurricular?
They were interested
like extra medicine.
In my refugee resettlement work, in my work with special needs kids, and travels, those kinds of things.
Okay.
And the deaf and hard of hearing group that I started in med school, they were much more interested in those extracurricular and pre-med school experiences. And so it made for a really natural, kind of free-flowing conversation because it's topics that I'm really familiar with and that I enjoyed.
Yeah, and I mentioned it on our first video. I felt like the reason I got in was because of my Spanish degree and my travels, that essentially my entire interview with one of the medical school staff or professors was all about my Spanish degree.
Yeah.
Not even, he asked me one question about my biology degree, and the same thing for residency. I know what I was going to ask. Anesthesia this year, the numbers were not in your favor.
No.
Do you remember the numbers?
I don't remember off the top of my
head. The odds were not in your favor.
The odds were not in my favor. And it was
it's like 3,400 and 1,700.
Something like that.
1,700 slots.
Yeah.
33 or 3,400 applicants.
I think something like a 70% match rate.
Okay.
I think.
So 30% did not match.
Possibly.
Okay. The numbers weren't great.
They weren't great.
So anesthesia is still very competitive.
Yeah. I was sweating it. I did not feel comfortable leading up to the match day or finding out, the mini match, which is when you get the email whether or not you matched, and then 5 days later you get where you matched. So I was nervous even for getting the email about whether or not I matched to begin with.
And that was an interesting thing because I did the military match, so it was completely different. We matched in, I think we found out ours in December. No, in December. And then that way we could scramble, they called it scrambling, to go on the civilian. If you didn't match military, then you had to do your civilian match. So that gave us time, 3 months to start prepping interviews. And then, so there's a process that you taught me about called ranked to match.
Oh, ranked to match. Yeah.
What does that mean?
I feel like it's more informal.
Okay.
And some programs will contact students, some won't. And it's to be taken with a grain of salt. So some programs might say you are ranked highly. After your interviews, you might get an email saying that, and before rank lists are submitted, you're ranked to match, you're highly ranked, we are really interested in you, some kind of buzzwords like that. It's an informal email that does not necessarily guarantee anything. And so I was kind of told by the general, I was on Reddit too much, which they say to be very wary of Reddit, and I should be wary of Reddit. But one of the things that was mentioned was be wary of those emails that you get that you're ranked to match, or you're ranked highly, to not kind of rest on your laurels once you've gotten an email like that, because just the match process can be so unpredictable. And hearing those words feels good. You think, oh wow, I'm ranked to match, so I'm going to match. But that's not always the case. So while I may have gotten those emails, I was still nervous going into the match.
Another thing that popped into my head. Oh, so you talked about so March 15th was our hard day.
Right.
That was your program that you actually got selected for. And then, but you said 7 days beforehand?
5 days. So that Monday.
The Monday you found out you matched in anesthesia somewhere.
Right. At one of the 12 programs that I had ranked.
Okay, so you ultimately, even though you interviewed at almost 30, you ranked 12.
Well, I applied to 32.
Okay.
I only got interviews at 12.
Oh, okay.
So that's kind of the reason for applying to a lot more then
Okay.
yeah, they say that the number of places you apply, you might get interviews from half of those. Possibly, it's roughly that number. And so I got less than half. So I got 12 interviews for
Okay.
anesthesia out of 32 applications, and of those 12, I ranked every one.
Okay.
Because you could interview at a place and not want to go there so badly that you don't rank it.
Okay.
That's an option, but I ended up ranking every
And you
program.
ranked was the advice. So obviously in the military, when you have your dream sheet, they always say don't put something on your dream sheet that you won't go to.
Right, yeah.
Is that the same thing?
Mm-hmm. Yeah. If you would rather...
Because you had a friend that happened to.
Yes.
Yeah.
If you would rather not match than go to this program, then don't rank that program, was the advice I heard from my school. So there was not a single program that I interviewed at that I hated so much that I wouldn't want to train there. So I ranked them all because I could find benefits to each program that I got an interview at.
Okay.
So I ranked them all. If there had been a program that I knew that I would be miserable at and I would hate and it would be a terrible fit, I would not have ranked that for fear of matching there, because that's, you could if you rank it, you could possibly match it.
Okay. Another topic.
Let's see. We have post-match and
Okay.
residency prep.
Okay. Yeah, so let's do post-match.
Post-match. So when I found out that I matched, I was so relieved.
Mm-hmm.
Because truly, at every single program I matched, I found something good about it. Even though I had my preferences, even my 12th rank, I found things about my very last rank that I would love and that I'd be happy to match there, truly. Even though it would be my last choice, I'd still had a lot of pros, versus cons. And so the fact that I matched at one of those 12, I was ecstatic. Because even if I had ranked my very last one, I was going to be excited.
Yeah.
So I was excited that I matched at all. And then when I found out where, over the moon. Absolutely over the moon. Just so happy. And I truly was doubtful. I mean, there's always that shred of doubt that I'm not going to match at all. And so I was very excited. I was able to breathe, felt so much relief that I was going to have a job for the next 4 years. And then finding out where was just icing on the cake. So I was extremely happy. And post-match now, so we had some transition to residency boot camps. We had 4 weeks of it, not continuous. It was 2 weeks, some vacation, and then 2 weeks of residency boot camp. So those were just some activities to knock out that were required by my school, and really was just relaxing, have been relaxing since match, and gotten to see family and hang out with friends and have a lot of vegetation time on the couch. And now I'm here visiting for the week and just really having a lot of fun, seeing people that I might not get to see much of for the next few years, like grandparents and extended family and friends.
And then looking back on your experience, starting back, and it's kind of unbelievable that you're actually a physician now. And then you were, one other thing. So one of my friends is a board certified anesthesiologist. That's been a professor for years, as well as had his own private practice. And he's a pain management specialist, which I think pain management is a great subspecialty of anesthesia. Tell me about what it felt like being called doctor yesterday in clinic for the first time.
It's still...
Did it feel different than it did in your 4th year rotations?
It did. Going from student doctor to doctor, it's very surreal. I almost just give this real big goofy grin because I'm like, really? that feels...
I'm a doctor.
I'm a doctor.
My little baby's a doctor.
And it does not feel real or like I've not that I've earned the title, because I know I've done a lot of hard work, but I feel like I haven't practiced as a doctor yet.
We haven't.
I haven't. And so, it just, I think it'll feel more real once I'm actually in the trenches. And right now, it's just, wow, I can't believe I can use that title now.
Yeah, and I think by Christmas, you'll be halfway through your intern year. You'll have had ER.
Mm-hmm.
I'm sure you'll do something in anesthesia by Christmas.
Mm-hmm.
You have a rotation?
Not an anesthesia rotation. I'll do pain clinic, but I don't do my anesthesia boot camp
Do you have
until
MICU
the
or
summer.
anything like that?
I will. Mm-hmm.
Before Christmas?
Mm-hmm.
Okay. So yeah, I think by Christmas you'll go, hey, I'm actually a doctor.
Yeah.
Then by the end of your intern year, obviously you'll have met the qualifications to get a license.
Yeah.
Like in Florida, you can get a license after your first year. Pennsylvania, I think, still takes 2 years. I had a residency classmate that her home address was Pennsylvania, and that's where she got her license, and she couldn't get hers till the end of her second year. Sarah. Remember Sarah?
Oh, yeah.
And in the military, that's a big deal because normally you go with where you think you ultimately might end up.
Mm-hmm.
So people would pick, where they predicted themselves to end up being a doctor and to do their first license. Yeah, so great.
I know, it's wild, and I do think I
My
remember.
little baby, my gosh, you're up so proud.
I'm sure I'll be calling a lot during intern year, and I think we should do another video maybe at the end of intern year.
Yeah.
Because I'm sure I'll have a lot.
Maybe even
more.
Halfway through. And
Over
it's
Christmas,
it's going to be interesting for you because you're not going to get a whole lot. It's just going to be a big difference between your internship and then when you start your CA2 year.
CA1.
CA1 year,
This
right?
I'll be going into like CA0,
CA0,
basically.
that's right. Yeah.
Yeah.
It'd be interesting how anesthesia split up.
It will be. And I remember going through med school, I would look at the class ahead because they'd always release these photos, a photo gallery of the class, whether they're celebrating match day or they're celebrating graduation. And I could not imagine myself either with that, I match sign or wearing the cap and gown, getting hooded. I just was like, I can't even imagine myself at that stage because being at that stage meant jumping through hurdles that hadn't happened for me yet, which was, applying to residency, interviewing, and then going through the match, and then to have my pictures now in that photo gallery, having gone through those stages.
Yeah.
It's really cool to reflect on, and I'm really excited for the next phase. And we'll be back on this couch, I'm sure.
Yeah. Awesome. So
Cool.
if you have comments, if you have anything that last time I promised to post a Word document with stuff and I never did it, but I think the only people that watched it were the family anyway.
Yeah.
So if there's any non-family members that want more details.
Or family.
If you want more details, just put it in the comments and Megan's very organized, so I'll put her on it and we'll upload it to YouTube. And yeah, anything medicine related, match related, residency, hard times in med school.
Mm-hmm.
We've both known them.
Mm-hmm.
Both had hard times. Both had friends in med school that had hard times. I was telling a story this morning at the coffee shop, our favorite coffee shop, that one of my gross anatomy classmates, I want to look up and see what he's doing. We were very, very close.
Mm-hmm.
And then I think, he had decided that he went into medicine, because his older brother was a doctor and it just he wasn't on fire for medicine. And so, there are going to be struggles like that. But I think ultimately, obviously for you, it worked out. All right.
All right. Thanks for watching.
All right.